Safe and Sterile Endoscopes, a new series from Beyond Clean, where we dive into the seismic shifts redefining endoscope reprocessing today. It's hosted by me, Hank Balch. In this series, we'll unpack groundbreaking innovations, sterilization standards, and best practices transforming patient safety in real time. With insights from industry experts and frontline champions, we're here to help you navigate the complexities of endoscope reprocessing and sterility. This series is proudly sponsored by ASP, Advanced Sterilization Products, protecting patients during their most critical moments. And now, sit back and stay tuned for an eye-opening journey into the future of endoscope safety. All right, welcome back. Episode 3 today of Safe and Sterile Endoscopes, the series on the Beyond Clean network. It's a 6-part educational series sponsored by Advanced Sterilization Products. And today we're talking to Benedicta Ampadu, the Global Product Manager at ASP, on the topic of safety. The title of this episode is The Struggle for Safety, Endoscope Reprocessing Challenges. So we're going to jump in today to the nuances around this conversation that we've had a couple of episodes now. We're almost halfway through. I guess we'll be halfway through at the end of this episode today in the series, but we're getting really practical today, and we're talking to someone who has that practical experience. I'm not going to steal your thunder, B, but can you introduce yourself to the audience here today?
Well, thank you, Hank. I'll be happy to. Hello, everyone, my fellow sterile processing technicians. My name is Benedicta Ampadu. I am, as Hank said, the Global Product Manager here at ASP. My background started in nurse midwifery. So I am from West Africa, Ghana, where I started as a nurse midwife, and I came to the United States and entered into the world of sterile processing technology. And so I have worked in the SPD department for close to 15 years. It's been a roller coaster, if you could say, various different hospitals. It's been a lot of learning experience, for me personally. And I'm really excited to jump on here and, talk about some of the key topics that, we as our industry have been talking about.
Great. Yeah. I know the interview today is not about midwifing, but I know that is one of the oldest healthcare professions in existence. All right. So, we're bringing it all the way in. And of course, that profession is still around, it hasn't changed much since the early days. And today, we're not going to be talking about giving birth to babies. We're going to be talking about giving birth to safe endoscopes in this process, if I can connect the two dots here today. And, we're going to start on this challenge with one of the kind of buzzwords when you're studying to become certified in this space from either organization. If you're studying to get directly your endoscope reprocessing certification, or if you're just studying more broadly to get certified in sterile processing, reprocessing, the word biofilm comes up, and it is a challenge no matter what you're talking about, but in particular on this conversation around endoscopes. So can you talk to us? We're going to have people that are tuning in from all different educational levels and backgrounds and experience in the industry. Maybe start at the ground floor. What do we mean when we say biofilm? And then we can talk about the formation and the impact that has on endoscopes in particular.
So personally, I consider biofilms as very fascinating things. And I know they fascinate. When you study them, it's very fascinating how they behave. Because if you think about it, they are really just trying to survive. It's an evolutionary mechanism, right? So think of, a free-floating bacteria. It adheres to a surface, and then it calls other microorganisms to come to it. And so these microorganisms join forces, they interlock. And when they do that, they also release a slimy, sticky substance that is called matrix. So just think of a bunch of bacteria interlocking, and then they release this matrix that surrounds them and encapsulates them. And so that is essentially what biofilm is. It becomes resistant to environmental factors like disinfectant solutions and things that, we want to use to clean or get rid of them. So that's basically what biofilms are. It's a colony or a community of bacteria that are interlinked and, very hard to get rid of.
Yeah, your comment about how they call each other, I don't want people to miss that, but like that's not the scientific phrase, right? but that's what happens is they kind of plant and then they get these signals, right, that they're sending off and basically saying, hey, I have found a place that I want to camp out. Y'all come camp out, and then we're going to build this shield around us, that matrix that you described. It's going to make it hard for people to get us and remove us. I mean, there's a lot going on in this one little topic of biofilm.
Oh, yeah. They're very fascinating. And the interesting thing is that they are found in nature. They're found in rivers. They're found in oceans. They are very critical to the, overall ecosystem that we have. But as it relates to medical devices, we don't want them.
Right. And so in general, biofilm is bad for medical devices. In particular for endoscopes, how do these biofilms impact our goal in trying to get a safe endoscope back to the patient?
They make it very hard to clean, right? But biofilms, when they adhere to surfaces, are very hard to clean. And especially with endoscopes because of how intricate and delicate they are. Endoscopes are, mainly for that to be able to visualize cavities. And so they come with the very minute components that sometimes when, we are cleaning, it's very hard for us to get into it. There's something called blind cleaning. I'm not sure if you're aware, but blind cleaning is basically you trying to or attempting to clean channels when you don't really have visualization to what you're cleaning, right? So that is really what endoscopes are. They have these very long channels that you are not able to really see what you're cleaning, but you're trusting that the tools that you're using to clean these channels are actually effectively cleaning it.
Yeah, so that's a good setup actually for my next question. You mentioned the word trust. And I want to go next to this human factors piece because trust does kind of have a role to play in that. We are humans. We're trying to follow a complex protocol many times to process these devices. But then as you just brought up, trust can be misplaced at times if the process or, if the protocol that we're doing, for instance, the blind cleaning is not actually the best practice to accomplish our goal. So yeah, maybe I guess we should start by defining human factors first, and then let's talk about like what they are in the context of reprocessing.
Well, in a perfect universe, we would have robots being able to handle our medical devices, reprocess them, clean them into contamination, wrap them, and chances of errors occurring will be, minimal. But, that's just something I'm making up. But right now, we have to utilize us, SPD technicians to perform these processes, these tasks to be able to render these instruments safe for patient use. And that's where human factors come in, right? So what are some of the things that we're doing that, would impact the reprocessing? One main thing for me has to do with inadequate training, right? So And Hank, the history of sterile processing, where they came from, right? From, different places where the education level is not as high. They're not qualified. I heard also that they pull people from, other places like orderlies and who do not necessarily have the basic understanding of, medical terminologies where, certain processes needs to be done in terms of reprocessing. And so inadequate training is a huge factor in sterile processing, which directly impacts, the reprocessing process of a device. If you cannot train your staff adequately, the chances of error occurring is very high. And so that's one main thing. Another thing for me has to do with workload and really time pressure. So because of the industry, there's very high turnover, right? There's not a lot, the pay is not as attractive. And so high turnover, we have our SPD technicians going to different moving from one hospital to another through agencies, etc. So there was really not a lot of tenancy, I should say. So the workload that we have for SPD, we have very few personnel doing a lot of work. And so you see that they end up skipping steps in the reprocessing process, and which would ultimately lead to errors occurring.
You mentioned the challenge of the workforce coming from so many different backgrounds, right? They're coming from experience sometimes in other healthcare roles, or maybe they're coming from other areas of the hospital that are non-clinical, but now this is their first time into the clinical environment. And then sometimes they're coming in graduates of a sterile processing training program. Sometimes they have their initial certifications. There's all kinds of different backgrounds that kind of play into that. And I'm a good example of that. My first job in a hospital setting was in sterile processing. So I knew nothing about what I was walking into and even what the risks were if I got it wrong. I knew that, these devices were being used in clinical procedures, but I didn't really, on day one, I wasn't able to connect the dots by if I skip this one step, what's the impact? How does this ripple out? Your comment about the training, I think, is very, very important, very well taken, because if you've got that diversity of a workforce and all of these gaps in just underlying foundational knowledge around the basics of sterile processing, and you have a broken or inadequate training process, that is all of the human factors lining up into a worst case scenario of you got staff that are being asked to do things that they've not been adequately trained or given the tools to do. And this is how we end up many times with these challenges.
Absolutely. Another thing also on the other side, right, has to do with communication breakdown. So, right, between, our OR staff, our SPD staff, as you know, there's always, there has to be continuous collaboration between the two, because these are, different departments that always work together, right? Making sure that communication is open and it's very clear, it's effective, to the point where everybody knows what the expectation is, the trays that are supposed to be prioritized, etc. So, and that is something that, it ultimately impacts reprocessing as well.
Right. Yeah, you mentioned time pressures. I want to come back to that in just a moment. But before we go there, I want to go into this piece of the puzzle. Let's assume that we got our training tight. It's a structured program. Everybody goes through the same training, and we'll just speak on a department level here for a moment. How you got a device that's coming through this process? The humans have been trained, and then you still got mechanical processes at work as well. There's the question of, is what we're doing what we want it to do? Is this cleaning effective? And I got to think there's a challenge there on how do we verify that, or how do we validate cleaning efficacy when it comes to these complex devices? Can you speak to, just that mindset or that structure and in encountering that question and starting to give us some answers there?
Oh boy. So I think that instruments themselves, right, due to the complexity of the instrumentation, it makes reprocessing or cleaning it a little bit difficult. Let's take, for example, our endoscopes, right? Our flexible endoscopes, because of where it is used, it's hard to clean. And so when I was an SPD technician, when I received a tray or an instrument, being able to take it apart and clean it effectively was crucial. But even when you reference the IFU, sometimes taking it apart was very hard, even with the instructions that was given. So when it comes to validating cleaning effectiveness or efficacy, even doing a visual inspection, sometimes the chances of you missing the debris is high. For let's say a spine rongeur. The spine rongeur instrument, and I'm sure you're familiar with that, they come apart and they have bones in that lumen, that side, right? So it is very hard to miss. It's very easy to miss that, right? Because some technicians don't know that they come apart. And so to me, it all ties into how complex these instruments are, how clear the IFUs should be, when it comes to taking them apart, because in SPD, there's a term or a saying that goes like, anything that comes apart should be taken apart for decontamination. And so MDMs, or medical device manufacturers, need to be cognizant of that when they are, developing devices for the purpose of, patient treatment, to make sure that easy reprocessing is in mind for our technicians to be able to take them apart and clean them well.
So you mentioned that visual inspection piece, and it made me think about what we were talking about in the previous question around human factors. Is you absolutely have to visualize, but then we also know that every person is different. And so if that training gap on what does visual inspection look like and what should it entail and how thorough should it be, and do you need any other ancillary tools like lighting or magnification, all of those things come into play. And, to your point about complexity, each one of those adds a layer of complexity and adds a potential gap to the process. What's nice, though, I know we're talking about challenges here, but we also have a number of new tools to help us to test the cleaning efficacy of our processes as well. And there's little like lumen checks, and there's flushing things that you can do. What has been the impact of those kinds of tools in overcoming this question that we're talking about?
Well, I think that with these tools that have, emerged on the market, there's been that sort of assurance, right? When it comes to, hey, if I use this new tool and I check, I feel assured that this instrument is clean. Like you have something like the protein test, right? The ATP test, and all those other tools that will help give you that level of certainty that this instrument that came through decontamination has been cleaned properly. And personally, I think that is a good thing. I did read certain journals and studies that sometimes these ATP tests are not as effective as they are marketed to be. And so that's something that, our SPD team needs to be mindful of when they are utilizing these tools. That yes, visual inspection is always a good idea. It's a good thing, a good process to follow, as well as, utilizing the tools like the lightning you mentioned. You have, the pipe cleaners to check and make sure that the channels were indeed clean, because I'm sure that you're aware of sometimes trays that come through decontamination to prep and pack, especially the ones with the lumens, right? They might, when you pass pipe cleaners through, you see that there's still some bioburden due to like ineffective cleaning.
Right. Well, and to your point about this piece, what we're doing in that assurance step, that quality assurance step, if you want to call it that, is we're actually gathering data about this process that's going through decontamination. And so, if we start seeing a number of failed tests, or we start seeing a number of these lumens that still have debris in them, then we go back to the process and then start identifying those gaps and improving the process. What we shouldn't do is say, that failed, go back, try it again. But then we're not changing the process. We're not improving the process over time. And so we just keep getting these failures and actually not doing anything about it. Yeah,
there's been, when I was in SPD, like in decontamination, you have this one person, right, that whenever they process trays, sometimes, you find bioburden in there. And those people are the ones that need more attention, because that is your indicator, right, that the training is not adequate for that person.
Right.
They need to be retrained. And so there are, many signals that could help our SPD team, be able to identify where the problem areas are to be able to, mitigate them.
Right. And if the problem in the process is a person, it's not a commentary on the person, to your point. It's a commentary on the structure, the training, the onboarding, the tools, on everything else, because that's the gap. And if you're not looking though, and you're not assessing the quality output of that decontamination stage, it's very easy to miss. And then you obviously end up with instruments that could impact the patient through infection, or through, even if it's a damaged instrument, there could be other harm that's associated with that. You mentioned earlier time pressures, and there has actually been studies around this on the impact of time pressures when it comes to quality reprocessing. Can you speak a little bit more in depth in this endoscope conversation, the impact that time pressures have on our goal to get safe scopes back to the patient?
Well, I have a perfect solution for time pressure, and that is get more inventory. But, realistically, it's not going to happen. I mean, if you have an account, right, that does a lot of cases and they have a limited amount, like a small amount of inventory, you're going to keep churning these instruments. And there are so many ramifications to that, wear and tear, so many other things that would impact the patient overall. So for instance, you have a set number of instruments, let's say 3 endoscopes, and you've scheduled 10 cases. And so this 3 endoscopes, I know I'm just, pulling numbers out of thin air.
That happens. No, I know, but you're speaking the truth. So continue.
Which means that the SPD person will have to just keep reprocessing this. And that is not maybe the only case that they have to focus on, right? That's not the only procedure that's happening in that account. And so the SPD technician is pressured to keep reprocessing these scopes and in a short amount of time, right? And so because they also want to, output more, they end up skipping steps. And these steps that are being skipped are going to be very crucial, which will impact the patients overall in terms of safety, because that is where our body's biofilm shows up. And then, right? And so eventually, there's going to be detrimental to the patient. And so time pressure is a big thing that I hope that, hospitals overall take into account, especially when they're purchasing these devices, to at least increase the inventory quantities to match the number of cases that you're doing, so that our SPD techs are not feeling pressured to turn over these trays quickly, and thereby in doing so miss some of these crucial reprocessing steps.
Yeah, I think that's absolutely critical. And even that inventory planning piece, there's an art and a science to it. So you do have to try to guesstimate your volume that you're supporting, but then you also have to keep in mind, hey, these devices, they sometimes get damaged. And so then they go out for repair, which then leaves us a device down in inventory. And are we going to be postponing procedures, or are we going to operate as normal? And yeah, that disconnect around your inventory volume, your scheduling volume, the speed of reprocessing, and then any margin for error or delay, all of that comes to bear on these humans in this reprocessing cycle. And they're the ones that are getting pressure now from all sides to get this device through as quick as possible. And that's never the goal. And that's not in any IFU or any training guide to process as quick as possible. It's we want to get this thing qualitatively reprocessed compliantly. And yeah, that inventory is a major systemic challenge around the U.S. today. Speaking of challenges across the U.S., one of the leading conversations, and we'll kind of start closing with this, if you will, it's the conversation around emerging pathogens. And just this last year, I was at the National APIC conference, and there was a number of sessions on emerging pathogens. This conversation is not going away. It's probably going to continue to be kind of headline news at our corner of healthcare. What impact do these emerging pathogens have on this conversation around reprocessing endoscopes?
Good question. So, we have a lot of, pathogens that are, emerging, like you're saying, and this is where biofilm comes in play. It also ties in a little bit to delays in reprocessing. In my opinion of this matter is that if there is a lot of delays in reprocessing, there is going to be biofilm formation, because it's going, the bacteria is going to proliferate. And then now you have to take longer to reprocess these scopes. And so it's always a good idea that whenever you receive our delicate endoscopes, we reprocess them, as soon as possible. Because with these pathogens that are coming out, they are becoming very resistant to a lot of the, medications that we have, and a lot of these reprocessing procedures that we have as well, such as high-level disinfection. Now, it's always it's good that you have to sterilize the instrument, which is the gold standard at this time, as opposed to high-level disinfection. And so we always ask our reprocessing technicians that it's always good to be able to process the endoscopes as soon as they receive them, so that there are no delays in reprocessing and no biofilms formation, or as minimum as possible formation.
Right.
During reprocessing.
Yeah, I think go back to what you said at the beginning of the interview kind of wraps this up nicely on this emerging pathogens piece, because you said, hey, biofilm, they just want to survive. It's kind of in there. It's in their DNA. That's why they're there. They want to survive. They want to proliferate. Same thing with these emerging pathogens. They want to survive, but then they also want to kill. That's why they exist. And it's in our best interest on the reprocessing side, as you have laid out here. We've got to be forward facing and always thinking, if there are new challenges coming to us, how are we going to confront those new challenges at that highest level of safety and care? And I think that is absolutely critical for us in that intersection as we are as reprocessing professionals. So terrific conversation today, B. I really appreciate you sharing your passion, your insight. It's flowing through the audio waves. I'm catching it. I'm getting excited about what needs to be done in this space and all the advocacy that we need around safety. So yeah, I really appreciate your time. Yeah,
for sure. And I want to share one fun fact that I learned,
sure.
And which was that, plaques in our teeth are essentially biofilm. Which is absolutely disgusting.
Isn't that gross? Yep. I had heard that before, and I'm like, oh man, I can't brush my teeth enough to get that stuff.
Like after every food, you gotta brush your teeth. But thank you so much for the opportunity. I love that we're using this platform to bring awareness to sterile processing. It is a department that I'm so passionate about, mainly because I didn't even know they exist when I was working as a nurse midwife. And so, right. I know. And I assisted in surgeries. I just thought the trace appeared. But we are critical for the overall operation of the hospital. So thank you so much for this opportunity and allowing me to voice my passion about sterile processing.
All right, that was B. Ampadu, the Global Product Manager at ASP, and you've been listening to another episode of Safe and Sterile Endoscopes, a 6-part series on the Beyond Clean Network, sponsored by Advanced Sterilization Products. If you've enjoyed this episode, maybe this is the first one that you've heard of the series. There are 2 more before this, and we got a couple more after this that's really diving into this endoscope reprocessing conversation, the history, the current challenges, and even what's coming down the pipeline in the future in this space. So highly recommend going and tracking those episodes down and subscribing to this channel anywhere the podcasts are heard. But until we talk to you again on the next episode, like we tell you each and every week here at Beyond Clean, keep fighting dirty.